During your exam is you should have your pen light handy, your tongue glide, this is a cleanlet, and then a cotton ball. And like I said yesterday in class, there are not any scenarios. It's just looking at skills straight up. And so part of that is that, you're assessing the, I feel like I'm rolling up my sleeves in some surgery here, is that you will do,
on your side.
That you'll do the mental status check. So I'll start out with asking some questions about that. But it's not anything really like I don't have to make up any big scenario, okay? So you ready? Hello, my name's Del Reed. I'll be your nurse today. Thank you for offering to be my patient to do this physical assessment skills. Just to verify your information, can you tell me your full name and birth date, please?
Christopher Allen Davis, 12 July 1982.
Great, thank you. That matches. And also says on my form here that you are a student. And where do you go to school again?
PLU.
Oh, and what do you major in?
Nursing.
Okay. I bet your mental status is intact if you can handle all of that, huh? Yeah, probably so. Good. Well, I'm going to, first of all, just check your vision. And so can you tell me how many fingers you see here?
1. 2.
No, that's kind of tricky, huh? And then can you hear this? Okay. And now the next thing I'm going to do is checking just some muscle strength and stuff in your face. It's a little bit odd, but can you squeeze your eyes together and then let me pull them open? Good. And then can you puff out your cheeks? Good. And then can you clench your jaw? Good. Thanks. Now we're going to check sensation. So can you close your eyes and then tell me where you feel this?
Where? Cheek.
Great. Thank you so much. And can you make a frown for me? Okay. Now, follow my finger without moving your head, and this is checking for cranial nerves 3, 4, 6. Good. Eyes move together, and can you follow my finger in as it gets closer? Pupils get smaller. Great. Thank you. Now I'm going to shine a light, and I want you just to look straight ahead. Direct. Consensual. Direct. Consensual. Super. See if your nose is tightened. So can you take a big breath in through your nose? Good. Sit on the side. That's good. Thank you. Let's take a look at your mouth. Go ahead and open. Good. Can you say ah? Okay. So good. Look on the side. Good. And can you lift your tongue to the roof of your mouth and side to side? Good. Thanks. Now I'm going to feel your neck free and lumps and bumps. My hands are cold. I this outside. It's freezing. And can you turn your head against my hand and this way and shrug your shoulders up? So that's checking the sternocleidomastoid muscle and trapezius. Take a listen to your lungs now. So big breath in through the nose and out through the mouth. So go ahead. Good. Out. Couple more if you're not too lightheaded here. I can listen to the bases. Good. You doing okay? Okay, so let's have a couple more. We'll get the right middle lobe here. And the same on this side. Good. Then just take a break and listen to your heart. So breathe quietly. Go into the second intercostal space. Listen to the aortic sound. Harmonic. Your normal F1, F2. Tricuspid at the fourth intercostal. And down a little lower. Mid-clavicular line. Fifth intercostal. Listening to the mitral. Regular radians, rhythm. Good, thanks. Now look at the interior breath sound. So big breath in. One more time. Now we're thinking about cardiac things. Let me check your radial pulses. So we're going to do some range of motion now, and I want you just to do what I am doing. So can you touch your chin to your chest, like flexion, look up at the ceiling, extension, straight ahead, rotation, rotation, straight ahead, lateral flexion, lateral flexion. Arms, can you reach all the way across, abduction, up and back, abduction, and internal rotation, across this way, abduction and external rotation. Great. Up this way, flexion. Down this way, extension. Arms all the way up this way, flexion. All the way back, reaching behind you, extension. Good. Now we'll do muscle testing. Arms straight out like this. Resist me pushing down. Deltoid strength in front. Push away with your forearm. Tricep, pull back. Biceps, good. With your wrist, can you go up, down, side to side? Spread your fingers. Don't let me push them together. Make a loop. Don't let me pull through. Perfect. And then we'll check you for strength here. Can you pull your wrist up on and then push down? And then pull up. And then push down. Great, thanks. Go ahead and lie down. And I'm going to check. Listen to your heart when you're lying down. First, I just want to feel over your heart and see if I feel any abnormal pulsations. And then we'll take a listen again. This time I'm going to listen with the bell. Same areas. Fabulous. And then while I have the bell, I want to listen over your abdomen. And I'm listening for both bell tones and also bruits over the aorta, renal arteries, iliac and femoral. And I heard bell tones at the same time. And then because you're up here in front of everyone, I won't lift your shirt, but I'm inspecting his abdomen now for any scarring or pulsations or anything like that. Okay? And now I'm going to just feel over your belly. So can you make your knees bent for me? And tummy soft. And let me know if you have any tummy muscle problems with this. And in each of the quadrants for masses. Good, thank you. Now while you're lying here, you should have his shoes off. I'm checking for any lower extremity edema. And I'm checking his feet for circulation. Good, thanks. All right, so you can go ahead and stand up again. And go ahead and stand up. And you're going to check your back. So scapula level, iliac crest level, hands together and bend forward. That all looks good. Great. Go ahead and stand up. That was flexion, now extension. Standing straight, rotation. Rotation. Good. Side to side, lateral. Lateral. Super. Now, if you could walk over toward the door, I just want to assess your gait. Good. Stop there and turn around. And now we'll take lower extremity strength and range of motion. I'll have you do a couple of these lunges like this. Okay, can you do that? Okay, good. That's it. Thank you very much. Good. So that was only 7 minutes. And so, that's my clock. So there's a lot of time, and I didn't feel real rushed. I don't know if I left anything out if you're looking through there, but I think I got it all. So you can see you don't have to be really not frantic about it. 10 minutes is a long time. Especially I really always feel that when I'm running or something. 10 more minutes. So 10 minutes is plenty of time, and I think the main thing is just for you to think about it so you can sort of have this approach. And I decided to check his strength for his sternocleidomastoid muscle early rather than the muscle strength, because in my brain I think of it as a cranial nerve test, and I was doing cranial nerves. Same thing with the trapezius shoulder shrug. That's a cranial nerve thing. Now, if you wait and do that with your MSK part, that's fine too. It's kind of however your brain puts the information together. So some of the things I didn't comment on, straight up. I didn't say that his ears were in normal alignment. I didn't say that he had a sty there, and I would say that probably if that was noticeable. And I didn't talk about the symmetrical facial features and that sort of thing. But really, we got all the cranial nerves in, we got muscle testing, we got range of motion, we got heart and lungs, we got heart and lungs lying down, we got the abdomen. And I'm not asking you to do like reflexes and all that sort of thing because and we got hearing, right? Exactly. So, questions about it or? No, not for the screening one. No, just the things there. So questions or things that were...
In our actual one, you want us to comment on, like, the facial features, the symmetry, and all that stuff.
Well, if you are going to chart that, I'll see that in your charting, so you don't necessarily have to do that. Okay, I did a little bit off and on, but what I would like to have you say, because this won't show up in your charting, is what muscle group you're testing and what the range of motion is called.
Okay.
Because that you should not... you won't write that whole thing. You'll just write full active range of motion or something like that. And
right.
So just that part.
Okay.
Yeah.
Now, well, are we doing this on each other
Yes.
then? So what would happen if, like, somebody, per se, couldn't, like, do that? Would you just say, you know, range of motion could not fully extend or something like that?
Yeah,
Okay.
yeah. So you make the comment, and then, like, if his deltoid strength, you know, one was weaker than the other,
Mhm.
then I would say that you know, his left was greater than the right or something like that. You just document whatever happens. I'm assuming that most of us will have normal, you know, normal assessments. So you're right, you'll just do it on each other. I have a sign-up sheet, so after the end of today's practice, last semester a lot of people were just ready to go after, you know, knowing that they wanted to do it next week and be done with it. So if you want to sign up while you're here,